Every patient should be enrolled in a surveillance. Usually for at least 5 years, we'll monitor patient after surgery. As a surgeon, my job is also to make sure they are receiving the adjuvant treatment. I sometimes follow them up 3 months to 6 months, not because I'm looking for a change, but because I want to make sure the radiation is completed, the chemotherapy is completed, the endocrine therapy has started. And so that way I keep an eye on them. And then I keep an eye on their lifestyle as well. Make sure they're not gaining weight, very important. Make sure their alcohol intake is less than 3 drinks per week, and making sure their lifestyle in terms of dietary changes are happening. So we want them to eat a Mediterranean type diet. Fruit, veggies, fibers, that's all they need to eat. But mostly making sure somebody's checking on them, making sure they're receiving imaging of screening every year, if not every 6 months, based on the risk they have, but they have to be surveilled for at least 5 years. Another important thing is their psychological aspect, because sometimes what I notice is that patients do very well during the diagnosis, and they receive the radiation, and then they're about to start their chemotherapy, and that's when their emotional being crashed after. And I always tell them, your brain held you together to make sure you overcome surgery and chemotherapy. And then when you're done with treatment, your brain is taking their own time to let it go. And that's when they need the most support. Sometimes they also have the physical change, for example, a mastectomy, who impacts, for example, the balance of the couple. I've seen a lot of patients losing their partners because their bodies change, and that has created significant change on the sexuality of the couple. And so that's why patient needs to be followed even after the treatment is done. And in our clinic, we follow them for 5 years, and then after that, we graduate them to the primary care physician.